Hey guys, Nick Sivrich here. I'm a physical therapist and I wanted to go over this week's question of the week. This week's question of the week is about the rotator cuff. And many of you may know or may not know, but the rotator cuff is a group of 4 muscles, and they're just based on your shoulder blade, and they all come around and attach onto your humerus, this long bone here. And without getting into too much detail about it, I'm not going to get into an anatomy lesson on the rotator cuff, but the main muscle that's torn most of the time is called your supraspinatus muscle, and it kind of sits up here and comes and attaches onto your shoulder. And that's the most common muscle that's torn in the rotator cuff. And a lot of people ask me that come to me after surgery, why can't I lift my arm? Why am I not allowed to lift my arm after surgery? And I mean, that's a good question. It's a very good question. And, because people think, I'm fixed now. Why can't I move my arm? I saw my, grandmother had her knee replaced and she's able to walk on her knee right after surgery, the day after. Why can't I lift my arm? And the reason behind that is, so the muscle was torn. Okay, you completely tore the muscle off the bone. So now they have to reattach it with sutures and screws, and they reattach that muscle to the bone. So now it needs time to heal to the bone. If you don't give its proper time to heal, you're going to tear it off the bone. And usually that takes about a 6-week period. Now, there'll be some doctors that are a little bit more aggressive in their rehab protocol, as well as physical therapists. But on average, that's usually what you see, around a 5 or 6 week turnaround, where that muscle heals to the bone before you can actually actively start moving it. And when I say actively, I just mean active motion. You're just lifting up and down. Most of the time, before that 6-week mark, you are doing what's called passive range of motion. And that's just basically when the therapist will take your arm and actually move it for you. And there'll be a few different stretches that you can be shown that are actually passive movements. But that's the main reason why you are not able to lift your arm up. It's not the fact that you may be able to do it physically, but you risk, you run down the road of risking tearing that muscle again that you worked so hard to get surgery and get reattached. So again, I hope that helped. I hope that was a pretty simple, simple answer, not too much to it. So I hope it helped. If you have any questions, feel free to comment in the comment section. Subscribe to my channel, like it, share it. Like my Facebook page at PT Answers Now, as well as check out my blog at nicksivrichpt.com. Have a good one. Thanks, guys.